Hey everyone, welcome to my channel Dental Edge. I am Dr. Chugh and today I'll be sharing with you what is a mucoepidermoid carcinoma. Now mucoepidermoid carcinoma, it's a very commonly asked question in examination. There can be a long question, sometimes a short note, and there can be many Viva, MCQ or fill up the blanks questions from the same. The slide is also kept for identification, so do watch the video till the end. Also, if you are new to my channel and are interested in dental videos, do consider subscribing it and click the bell icon so you don't miss anything. To join my regular online oral pathology classes, you can contact me on the number mentioned on the screen. Also, notes for this topic are available. The link for the same I'll mention below in the description box. Now, let's get started with today's topic, that is a mucoepidermoid carcinoma. So, mucoepidermoid carcinoma, as the name suggests, the word carcinoma itself means that it is a malignancy of epithelial tissue origin, right? So, it's a malignant tumor and it is a malignancy of salivary gland tissue origin. Now, if we see the term mucoepidermoid, let's divide this term into two parts, muco and epidermoid, and the name suggests that there are presence of two type of cells in this tumor, that is, there is presence of mucus secreting cells from the word muco, and there is presence of epidermoid or cells with squamous cell features. So there are epidermoid type cells. So from the name, 2 points we understand that there is presence of mucus secreting cells, there is presence of epidermoid, that is squamoid feature like cells, and it's a malignancy of epithelial tissue origin, right? So it's a malignant tumor, right? So it's a malignant epithelial tumor. It is composed of mucus secreting cells and epidermoid type cells. There is one more type of cell, we'll come to it later on. Then these cells, they are present in varying proportions. In addition, there can also be presence of columnar and clear cells, and often this tumor, it shows prominent cystic growth, right? Then mucoepidermoid carcinoma, one of the most important questions is that it is the most common malignant salivary gland tumor occurring in both major and minor salivary gland tissue. So, if somebody asks you which is the most common malignant salivary gland tumor, the answer is mucoepidermoid carcinoma. From this, we come to one more question, which is the most common salivary gland tumor, and with the most common salivary gland tumor is pleomorphic adenoma, right? So most common tumor is pleomorphic adenoma, right? Pleomorphic adenoma, and the most common malignant salivary gland tumor is a mucoepidermoid carcinoma, right? So it occurs in both major and minor salivary glands. Which are the major salivary glands? Parotid gland, submandibular gland and sublingual gland. And which are the minor salivary glands? These are the glands that are present within the oral cavity, in the palate, tongue, lip, right? So this mucoepidermoid carcinoma, it involves both major and minor salivary gland tissue, right? It accounts for 5% of all salivary gland tumors, right? And the most common site, remember this, the most common site is parotid gland, right? So the most common site is the parotid gland, and intraorally, if we see the minor salivary glands, the most common site in the minor salivary glands is palate. Coming to the sex predilection, remember that in almost all salivary gland neoplasms except Warthin's tumor, the sex predilection is it is more common in female. So it is common, there is slight female predilection. Coming to the age of the patient, it can occur in any age, but it most commonly occurs in the 3rd or 5th decades of life with an average age of 47 years, right? So there is female predilection and the age is 3rd to 5th decade usually, and the average age is 47 years. Now one more thing that you need to remember is it is the most common malignant salivary gland tumor in children, right? This can be a question. Pathogenesis of a mucoepidermoid carcinoma is not very clear, although prior exposure to radiation is one of the risk factors for developing mucoepidermoid carcinoma. So pathogenesis is uncertain, although radiation exposure may be a risk factor. Continuing with the clinical features, now remember that there are low-grade tumors and there are high-grade tumors. What do I mean by a low-grade tumor? A low-grade tumor means a tumor that is less aggressive, has a better prognosis. A high-grade tumor is a tumor which has worst prognosis and it is very aggressive, right? So first let's see what are the clinical features of a low-grade tumor. A low-grade tumor, it is slow-growing, painless mass. It rarely exceeds 5 cm in size, so rarely exceeds 5 cm in diameter. It is not completely encapsulated, right? And it often contains cyst filled with mucoid material. And I told you what are the common sites. Intraorally, the common site is most common site is palate, and it can also occur in other sites where salivary gland tumors are usually not very common. So other sites like buccal mucosa, tongue and retromolar areas can also be involved. Coming to the clinical features of a high-grade tumor. Now a high-grade tumor, it will grow to a large size rapidly. So rapidly growing swelling is there. Pain is an early symptom. This is important. The patient will complain of pain. Facial nerve paralysis is frequent in parotid tumors. So a mucoepidermoid carcinoma involving parotid gland, a high-grade tumor, it can lead to facial nerve paralysis. Other complaints are there can be trismus, that is difficulty in opening the mouth, drainage from the ear, dysphagia, that is difficulty in swallowing, numbness of adjacent areas, and ulceration. Ulceration is commonly seen in intraoral sites, right? So particularly in tumors of minor salivary glands intraorally. It is this high-grade tumor, it is non-encapsulated and it tends to infiltrate surrounding tissue, and it can also, in many cases, there will be metastasis to regional lymph nodes. So many cases metastasize to regional lymph nodes since it's a malignancy, right? So it can metastasize to regional lymph nodes. Distant metastasis can also take place, and what are the common sites for distant metastasis? They are lung, bone, brain and subcutaneous tissue. So these were the clinical features of a mucoepidermoid carcinoma. If we see this clinical picture, this is a mucoepidermoid carcinoma on the hard palate, a swelling as you can appreciate having a slight bluish tinge, and this is a mass on the tongue and it was diagnosed as a mucoepidermoid carcinoma. So this is another case on the tongue. Coming to the histopathologic features of a mucoepidermoid carcinoma. So it is composed of, as I already told you, there are two types of cell are already present that is indicative from the name mucoepidermoid, right? So there are mucus producing cells, right? Muco, and epidermoid. So there are epidermoid like squamoid feature cells, right? So there are squamous or epidermoid cells. Now there is one more population of cell which is called as intermediate cell, and it is a very important cell. It is important for the diagnosis of a mucoepidermoid carcinoma. So three cells are seen: mucus producing cells, epidermoid or squamous cells and intermediate cells. Now let's see what are the features of these particular cells. So how will you identify, how will the mucus producing cells appear? Now these mucus cells are of various shape and contain abundant foamy cytoplasm that stain positively with mucin stains. So mucus cells, they vary in shape. They are large cells, the nucleus towards one end, it is filled with mucin and they stain positively with mucin stain and the cytoplasm is foamy. So mucus cells are of various shape and contain abundant foamy cytoplasm. You will see empty foamy cells that stain positively with mucin stain. If we see this image, these are the mucus cells. Can you appreciate these large cells and the nuclei is towards one end because they were filled with mucin, and their foamy cytoplasm is present. This is a mucus cell, right? Now let's see what is an epidermoid cell, right? Epidermoid means cells that have features of squamoid cells, flat cells, right? What are the features? So epidermoid cells are characterized by squamoid features, flat cell features. What are they? Often demonstrating a polygonal shape, right? So it will have a polygonal shape, intercellular bridges, and rarely it shows keratinization, right? So rarely they show keratinization. So epidermoid cells, these are the epidermoid cells, right? Flat cells, showing slight pleomorphism in this case, but these are flat cells. So they are polygonal shaped cells, intercellular bridges are there, and rarely keratinization may also be seen. So these are the features of an epidermoid cell. Now let's see what are the features of an intermediate cell, right? So intermediate cell, they are more important in recognizing mucoepidermoid carcinoma. So they are an important group of cells. They are highly prolific, proliferating cells, basaloid cells these are. They are larger than basal cells, but they are smaller than the squamoid or epidermoid cells. So they are larger than basal cells and smaller than the squamous cells. Small cell, slightly larger than typical basal cell, having a nucleus that is completely filling the cell, scanty cytoplasm is there, right? It is believed to be, why is this cell important? It is believed to be the progenitor of mucus and epidermoid cells. So what do we mean is that they are thought to be the progenitor, these intermediate cells, right? This intermediate cell, it is thought to be the progenitor for both mucus and epidermoid cells, right? So therefore they are thought to be the important cells, right? Now in this image we can see mucus cells. This is an image showing many cells. So these are the empty cells are there, these are the mucus cells, pleomorphic epidermoid cells are there, and there is a population of small cells which appears to be the intermediate cells, right? Now, so histopathologically what we learned, there are three types of cells: mucus cells, intermediate cells, and there are the epidermoid cells, right? Mucus and epidermoid we know from the name only. One more name we need to remember, that is the intermediate cell, correct? So these cells are present. Now how are they arranged? One more point, some tumors, I already told you, they also show presence of clear cells. They also show variable number of clear cells. Now these mucoid, epidermoid cells or intermediate cells, they are present in solid masses or cords, or they may also be seen surrounding a cystic space. So these epidermoid, mucus and intermediate cells, they line cystic space or form solid masses or cords, right? Epidermoid and mucoid cells may be arranged in glandular pattern, right? The cyst, they may sometimes rupture and mucin is pooled in the space. The cyst may rupture, liberating mucin, which may pool in the connective tissue and evoke an inflammatory reaction, right? So what you need to remember, there are three types of cells: mucus producing cells, epidermoid cells, intermediate cells. These cells, they are arranged around cystic spaces, or they are arranged in solid masses or cords, right? This is what you need to remember. Sometimes clear cells are also present. Again, this image shows all the three types of cells. Mucus cells are there, epidermoid or flat cells are there, and there is a population of small cells, that is the intermediate cell is also there, right? This is a diagram, an oral pathology diagram for mucoepidermoid carcinoma, right? What all we can see? We can see this cystic space. This is a cystic space, right? This is another cystic space. They are lined by different cells. These are the large cells. Empty foamy cytoplasm is there. These are the mucus producing cells, right? These are the mucus producing cells. Again, these are the mucus producing cells. These are again the mucus cells. So there are large cells, vary in shape, foamy cytoplasm. This is one type of cell, right? Then there are epidermoid cells. You can appreciate these are the flat cells that I have drawn. These are the second population of cells, that is the epidermoid cells. And then there are small cells, right? Slightly larger than basal cell but smaller than the squamous cells, and they are the intermediate cells. These are the intermediate cells that I have drawn, intermediate cells, right? So this is the third population, that is the intermediate cells. We can also appreciate cystic spaces. This is a connective tissue stroma, right? So this is how you will draw the diagram of a mucoepidermoid carcinoma. I have also uploaded a lecture on how to draw the diagram of mucoepidermoid carcinoma. The link for the same I'll mention above, and you can check that out as well. One more thing that you need to remember, you now know the histopathology of mucoepidermoid carcinoma, but this mucoepidermoid carcinoma, based on certain features, it is divided into 3 grades, right? There are 3 grades of tumor. So traditionally, mucoepidermoid carcinoma have been categorized into one of 3 histopathologic grades based on the following. So we'll divide this tumor into 3 types: low grade, intermediate and high grade tumor. And on what basis I'll divide it? I'll divide it on 3 bases. Amount of cyst formation, we saw there was cyst formation. So amount of cyst formation, this is histological grading, right? Degree of cytologic atypia, it's a malignancy. So there will be abnormal pleomorphic cells. So how much is the pleomorphism, right? Then based on the relative number of the 3 cells that we saw, mucus, epidermoid and intermediate cells. So based on these 3 factors, the histopathologically the tumor is divided into 3 types. Now let's see how will we divide it, right? So these are the 3 gradings. One is the low grade tumor, then intermediate grade tumor, and the third is the high grade tumor. Now based on these 3 factors, amount of cyst formation, degree of cytologic atypia and relative number of mucus, epidermoid and intermediate cells, let's see how will we divide these into different grades. So low grade tumor, it will show prominent cyst formation, right? So it will show prominent cyst formation. Cytologic atypia, obviously I told you low grade tumors, they have the best prognosis, they are less aggressive. So cytologic atypia, abnormality, right, will be less. So it will have minimal cellular atypia. And which cells we'll see the most? We'll see all types of cell, but there is high proportion of which cell? So there is high proportion of the mucus cells. Now let's first see the high grade tumors and then I'll come to the intermediate grade tumors, because intermediate grade tumors, they fall between these 2. So let's see the other end, that is the high grade tumor. Now high grade tumors, in this there was cyst formation. In high grade tumors there is presence of solid islands and there is minimal or no cyst formation, right? So there is presence of solid islands of squamous and intermediate cells. Why squamous and intermediate? Mucus cells are very rare in this case, right? So it has basically 2 population, squamous and intermediate. So there will be solid islands of squamous and intermediate cells in case of a high grade tumor. Again, it's a high grade tumor, so there will be maximum cellular atypia, pleomorphism, mitotic activity. So in this case, opposing to the low grade tumor, cells demonstrate considerable pleomorphism and mitotic activity. And I told you mucus cells in this low grade were maximum, in this they are minimal, right? So mucus producing cells are very less. What are the predominant cells? Intermediate and the epidermoid cells, right? Now let's see the intermediate grade tumors. They fall between these 2. So features that fall between those of the low grade and the high grade: neoplasm, cyst formation. In this it was prominent, in this it was minimal, there were solid islands. So in case of intermediate tumors, cyst formation occurs but is less prominent than that observed in low grade. So cyst formation is there but it is not very prominent, it is less prominent. Then degree of cellular atypia. Cellular atypia may or may not be observed. In this minimal, in this very much cellular atypia, in this it may be present, it may not be present. And relative number of cells, we saw in low grade tumor, mucus cells were there. In high grade tumor, mucus cells were minimal. In this, all 3 cell types are seen, but intermediate cells are the most prominent. So all 3 major cell types are present, but intermediate cells are the predominant. So this is, if you know this table, you will be able to write very nicely in your examination, low, intermediate and high grade tumors, how are they classified histopathologically, right? So from this we complete the histopathologic features. Now let's see the variants of this tumor, right? So you just need to remember there are 2 variants. Sclerosing mucoepidermoid carcinoma, in this excessive sclerosing is seen. You just need to remember the name. One of the variant is sclerosing mucoepidermoid carcinoma and the other is intraosseous mucoepidermoid carcinoma. If mucoepidermoid carcinoma occurs within the bone, intraosseous, the word only means within the bone. So when it is occurring within the bone, that is within the jawbone, then it is called as intraosseous mucoepidermoid carcinoma. So these were the two variants of this tumor. Coming to the treatment and prognosis of a mucoepidermoid carcinoma. So surgical excision is the treatment of choice. Conservative excision with preservation of the facial nerve. I am talking about parotid gland tumors, right? So if there is a tumor in the parotid gland and if it is of low and intermediate grade, then we will go for surgical excision and we will try our best to preserve the facial nerve. So conservative excision with preservation of the facial nerve if possible is recommended for low and intermediate grade mucoepidermoid carcinoma of the parotid gland. In case it is involving the submandibular gland, it is completely removed. The affected submandibular gland should be removed entirely, right? In case of high grade tumors or large tumors, then in such case radical neck dissection is also performed in patients with high grade tumor or patients who show cervical lymph node metastasis, right? In such cases, we will do radical neck dissection. Treatment for minor salivary glands is also primarily surgical, and for high grade tumors, post-op irradiation and chemotherapy is also recommended, right? So the basic line of treatment is surgical excision, especially for the low and intermediate grade tumors. If it involves the cervical lymph nodes, radical neck dissection is done, and in case of high grade tumors or large tumors, we can also go for post-operative, post-surgical irradiation and chemotherapy, right? So now let's summarize mucoepidermoid carcinoma, very commonly asked question. One of the most common thing they ask is which is the most common malignant salivary gland tumor, and the answer is mucoepidermoid carcinoma, right? One more question, which is the most common malignant salivary gland tumor in children, that is also a mucoepidermoid carcinoma. Which is the most common site? Most common site is parotid gland. Intraorally, if I talk about, it can occur at any site, buccal mucosa, lip, anywhere it can be there, but the most common site is palate. So intraorally, most common site is palate. Usually the common site is parotid gland, slightly more common in females, right? Then age, it can occur at any age, but the most common age is 3rd to 5th decade of life. Coming to clinical presentation, we read about two types, low grade tumors and high grade tumors. Low grade tumors, they are usually less than 5 cm in size. A slowly growing swelling is there. It is painless. High grade tumors, although pain is a very common feature, they may also cause, if involving parotid gland, facial nerve paralysis, and it enlarges at a very good speed, and it can also metastasize to regional lymph nodes, or distant metastasis to lung bone can also take place, right? Then what is the most important thing histopathologically? That there are 3 types of cells: mucoepidermoid, mucus producing cells, epidermoid cells. One more population of cell, which is the intermediate cell, and which is very important for recognizing mucoepidermoid carcinoma. This intermediate cell is thought to be the progenitor of these both mucus and epidermoid cells. How will mucus cells appear? They will show foamy cytoplasm and they stain positively for mucin. Then there are epidermoid cells which have squamoid features, flat cells, polygonal shaped cells, intercellular bridges are there. Then there is intermediate cell which is thought to be the progenitor, and it is larger than the basal cell but smaller than the squamous cells, right? Then there is histopathologic subtyping, 3 types: low grade, intermediate grade, higher grade, based on amount of cyst formation, the cytologic atypia, amount of cytologic atypia, and the type of cell predominantly present, right? Treatment, usually surgical excision. For high grade tumors, the surgical excision can be followed with irradiation and chemotherapy, right? So with this, we are done with the topic mucoepidermoid carcinoma. I told you notes are available. Link for the same I am mentioning below in the description box. If you want to learn how to draw the diagram of a mucoepidermoid carcinoma, again, the link I'll mention below in the description box. Also, to join my regular online oral pathology classes, you can contact me on the number mentioned on the screen. Also, if you like the video, do press the like button, subscribe to my channel and keep watching. Thank you.